Good afternoon, everyone. Thank you so much for joining us today to talk about the Indiana Housing First program RFQ release. Today, our agenda is to first review the policy manual and note any updates from last year, and then we will review the RFQ in detail. This meeting is being recorded. I can provide a copy of the PowerPoint presentation as well as a copy of the recording upon request. Okay, so first we will do a policy manual overview just to provide an overview of the Indiana Housing First program. So the purpose of this program is to provide rental assistance and supportive services to households where at least one individual has a serious persistent mental illness, a chronic chemical addiction, or a co-occurring serious and persistent mental illness with a chronic chemical addiction where the whole household is facing a housing crisis. This was established in 2017 by the State General Assembly, and program regulations can be found in the Indiana Code. The program model does follow the Housing First model. So this approach is person-centered. It follows the belief that individuals are immediately housing ready. So there are no preconditions to housing. Services must be voluntarily selected by participants and predicated on a harm reduction approach. So through this program, services must be offered to participants and available where participants live or easily accessible, but they cannot be required as a condition of being in the program. Similarly, the harm reduction approach means that abstinence cannot be required. Assistance is time limited with the goal of increasing self-sufficiency. The program requires through the Housing First model that there is low barrier entry criteria. So program recipients, if you are to receive this grant, cannot impose additional barriers. Participants may not be denied entry for having too little or no income or an active or history of substance use. And then similarly, participants cannot be terminated from the program for refusing to participate in services or making progress on a specific service plan, loss of income or failing to improve on their income, and then any activity not covered in the participant's lease agreement. Participants must have a typical lease with all the rights and responsibilities afforded to any leaseholder. That is a requirement of our program, and the lease must be renewable. The program requires that recipients implement the critical time intervention approach, which is an evidence-based practice that has been successful for providing housing assistance to individuals with a serious mental illness. So the goal of CTI is to really build those long-lasting community supports, particularly from the time of transition back into the community. So the CTI case manager typically has a small caseload of approximately 15 clients. CTI is typically split into 3 phases of 2 to 3 months each. You know, in practice, individuals do need very tailored assistance. So when you're implementing your program, you can really individualize what your phase plan looks like for CTI. And then IHCDA does provide very in-depth CTI training throughout the grant term, which we do provide to recipients of this grant at no cost to the recipients to ensure that all Housing First grant recipients are able to offer that CTI engagement model to their program participants. So program activities. So program funds can be used to provide tenant-based rental assistance and associated housing costs. A minimum of 60% of funds must be used for this category. Previously, this requirement has been a minimum of 70% of funds. This has been adjusted this year. A maximum of 30% of funds can be used for supportive services. Previously, this was a maximum of 20% of funds, so this is a change this year. And then a maximum of 10% of funds may be used for administrative costs. Participants do not have to be enrolled in supportive services to receive rental assistance and vice versa. So households may receive only rental assistance, only services as needed by the household. So at least 60% of the grant must be used for rental assistance and other housing costs. These would include monthly rental payments, utilities included in the rent, up to 3 months of rental arrears. We would allow lot rent. These payments must be paid directly to a third party on behalf of the household. And then rental payments are limited to 24 months per household per episode of housing crisis. So as we stated before, this is a time-limited program. The other housing costs, other eligible housing costs also include security deposits up to the value of 2 months of rent, up to 3 months of utility arrears, utility deposits and ongoing utility payments, application fees, one-time moving fees, and then costs for housing search, HQS assessments, and calculating participant income. This last category is one that we have clarified this year. This may be at the recipient's discretion, may be reimbursed to either administrative or rental assistance costs. So this really depends on how the recipient would, budgets this out. So for supportive services, a maximum of 30% of the overall grant amount can be used for supportive services. So there's a wide menu of supportive services that can be reimbursed for. So this would include employment assistance, substance abuse and addiction treatment, life skills assistant, transportation assistance, legal services, etc. Something noteworthy this year is that we have added as an eligible cost, costs of acquiring essential household items not to exceed $250 without written permission from IHCDA. Previously, costs of acquiring essential household items was not eligible at all. So we have added this as an eligible activity. Similarly, under developing plans, making referrals, or connecting to the types of services listed above, we only allowed internet services, and we have now allowed phone services to be eligible. So for eligible administrative costs, a maximum of 10% may be used to reimburse for administrative costs. This would include processing claims, reporting, conducting HQS inspections, housing search, determining participant eligibility, IHCDA approved training, those items. Ineligible costs include the items listed on this screen. So, for example, mortgage assistance, other items paid to homeowners would not be eligible. Hotel and motel payments are not eligible for this program. We still do not allow cable or satellite services. We do not allow monthly utility payments to be paid for households if they're not receiving rental assistance. Furniture and other household items with costs exceeding $250 if permission has not been provided from IHCDA, so that is modified from before. And then other costs not listed if permission has not been given from IHCDA. So eligible participants in this program are defined, and this is from the state code, as individuals with a serious mental illness, a chronic chemical addiction, or a serious and persistent mental illness with a co-occurring chronic chemical addiction resulting in a housing crisis, which we will define later in this presentation. So participants do not have to income qualify at initial enrollment, and there is no maximum income limit. However, if participants would like to receive more than 12 months of rental assistance, then the household income must be at or below 50% of the area median income. If a household has an income that exceeds 50% AMI and would like to receive an additional 12 months of assistance, then they cannot receive rental assistance, but they may continue to receive supportive services for the additional 12 months if the household still contains at least one individual who does have that qualifying diagnosis, and the household still requires that assistance in order to avoid a housing crisis or a return to homelessness. So those specific circumstances are outlined in our manual. And like I said previously, recipients cannot establish a minimum income requirement for the program and must accept households with little or no income. So a housing crisis is defined as a situation in which an individual or household does not have sufficient resources or support networks immediately available to maintain safe and affordable housing or to prevent the individual or household from requiring emergency housing, So a household is determined to be in a housing crisis if they meet one of the following conditions listed on this slide. So that would be, if they are currently living on the street, if they're living in temporary housing and they must vacate within 2 weeks. If they are facing an imminent court-ordered eviction, then they are eligible for some assistance. If they're exiting a residential treatment program or living in an institution. So IHCDA will work with all award recipients to finalize and approve the participant selection plan to ensure that all participants are eligible and that the criteria does meet the code and our program regulations. But recipients must prioritize that they're serving eligible persons who are also medically vulnerable and either immediately lacking housing resources or who must immediately exit a residential treatment program. So as we discussed previously, eligible households may be enrolled in the program for a maximum of 24 months per housing crisis. If participants are receiving rental assistance, they must have a valid lease with the property owner that must be renewable and for at least 12 months. The rent charged by the landlord must be determined to be reasonable. There are in limited instances, recipients may approve a lease that is not reasonable. So this would be if there's a very tight rental market, if the rent has increased for a second year and the rent is no longer reasonable, but the participant would like to stay there. So we have guidelines where under very limited circumstances, leases that are not reasonable may be approved, but that should be in very limited instances. And then the participant's rent contribution must be at least 30% of the household's monthly adjusted income with the goal of decreasing the subsidy over the term of assistance. So recipients can, create their own subsidy models as necessary and as meet the, the expectations of CTI and your own implementation of CTI. So IHCDA has adopted the Housing Choice Voucher Program quality standards for the program in terms of, so housing quality standards consist of the 13 key aspects of housing quality, performance requirements, and acceptability criteria to meet each performance requirement. So all recipients must be required to conduct an HQS inspection of the unit before allowing the participant to move in. And then if the lease is renewed, that must happen annually. IHCDA will provide guidance on how to conduct an HQS inspection. And then in our manual, there is a link to the appropriate form. And then recipients cannot perform HQS inspections on units they own or in which they have a financial interest. Recipients will be required to submit a monthly report which identifies the households served throughout the program as well as a snapshot of funds expended each month. Information about this is in our policy manual, and we do allow budget modifications. So for example, if you originally requested 30% supportive services, but then over time you believe that you decide to put more of that into rental assistance, we would allow that, and we have a process for that. We do require that all recipients report information about their participants into the Homeless Management Information System, or HMIS. So we will determine the HMIS that the recipients use based on the geographic location of the project. So recipients who are located in Indianapolis can discuss with us whether it's more appropriate to use the Indianapolis HMIS, whereas recipients that are located in the balance of state will use the IHCDA HMIS. So all recipients of Housing First funds are expected to expend funds in a timely manner. All of our award agreements for the Indiana Housing First program last 24 months and will include target benchmarks for expending these funds. If a recipient fails to expend program funds during this time or fails to expend them in accordance with the target benchmarks, then IHCDA is able to reallocate unused funds either from one recipient to another or put them back into the Housing First Fund to grant during the next RFQ. So now I'll provide an overview of this year's request for qualifications. So on June 6th, the RFQ was released to the general public. Today, we are having the informational webinar. Responses are due to IHCDA by 5:00 p.m. Eastern Time on July 25th, 2022. And then on August 25th, at the IHCDA Board of Directors meeting, IHCDA will announce the selected respondents. Shortly after that meeting, IHCDA will also notify the respondents via email of the selection. So eligible applicants are nonprofit corporations, 501c3 nonprofits, as well as public housing agencies or local units of government. These entities may subgrant to or enter into relationships with the following types of organizations. So nonprofit or faith-based organizations, businesses, public housing agencies, social service providers, mental health providers, etc. These eligible applicants are also listed in the manual. We are allowing that applicants may request an amount between $100,000 and $300,000 for a 2-year grant term, which is 24 months from the award date, which is described in the award agreement. So once again, you must use up to 60% or more of the funds for rental assistance and housing costs. Up to 30% of funds can be used for supportive services, and then up to 10% of funds may be used for administrative costs. So evaluation of all responses received will be completed by a selection committee of staff from IHCDA. Applications will be scored according to the point system, which is described in the RFQ, and applications which fail the threshold review will not be scored. Past award performance, which includes the history of complying with federal, state, and local guidelines and meeting benchmarks and quality of work performed, will be considered. Any entity currently disbarred or suspended will be disqualified. And then once again, recommendations will be taken to the August Board of Directors meeting for approval. So our threshold criteria are first the 501c3 not-for-profit status, or being a local housing authority or local unit of government. Financial capacity to administer the program, and then a complete compliant proposal addressing all required items. The overall experience of respondent and partners will be scored out of 20 points. Here we are looking for a narrative which includes experience administering rental assistance, experience providing or collaborating to provide supportive services, and then a description of experience addressing housing crises and addressing mental health or addiction, particularly noting how you have used the Housing First and critical time intervention models and the harm reduction approach. If you do not have experience addressing these circumstances or using these approaches, then please describe your relevant experience, so specifically working with other vulnerable populations. And then if you have partners, please describe their experience and then narrative as demonstrated by, their expected contributions and then past examples of collaboration. The readiness to proceed criteria will be out of 20 points. And the narrative will include a justification of the need for this program in the proposed coverage area, a description of how you'll identify and engage partners and landlords, a description of the proposed strategy for identifying program participants, and then a proposed program timeline. And then we are looking at for a start and end date there as well. The program description section will be scored out of 25 points. And here we're looking for a description of the overall scope of the program with a narrative which lists the geographic location to be targeted, describes the number and structure of staff involved, the proposed participant selection plan, which should be informed by the program administration manual. So really keeping in mind who is an eligible applicant, the prioritization of medically vulnerable, incorporation of coordinated entry, all of the bullet points listed there in the participant selection plan section. And then the plan for incorporating client feedback and improving the program over time. If you are a current Housing First recipient, we would really like to see what steps you have already taken to use client feedback to improve your existing Housing First program. The service delivery section is also worth 25 points. Here we're looking for a description of the service delivery plan where the narrative will include information about the case management ratio and staffing model, a description of how the services provided really fit that eligible population, a description of transportation services if they're provided, assistance in applying for mainstream benefits if provided, and then mental health treatment and substance use treatment that will be offered to program participants. And then, really describing any additional services to be offered to program participants, whether directly by the applicant or any of those partner agencies. So description of key staff and the budget will each be worth 5 points. For description of key staff, for the lead, we would like current resumes, but also an explanation of why these staff are being selected for their role on the Housing First program, and then a current organizational chart. And then we will need the Housing First program budget form to be complete, which is provided on our Indiana Housing First webpage. And then if there are additional funding sources that will be brought to your program, please provide a narrative explaining that. Past or current Housing First recipients will be scored in an additional category based on their past award performance. So there is no documentation or narrative submission required from past Housing First recipients. This is scored by IHCDA, and we will review, excuse me. We will review the history of meeting benchmarks, quality of work performed, and services provided, and the full expenditure of funds. Excuse me. So the items that are required to be submitted are the qualifications cover sheet, which is a template included in the RFQ, the certification of company, which is also a template included in the RFQ, the verification of 501c3, financials for the lead applicant, all of the relevant narratives, a description of key staff, and then that budget form completed. We do require that responses are submitted via email in PDF. Please submit those responses to me at my email here, vjennings@ihcda.in.gov. And the deadline for that is Monday, July 25th at 5:00 p.m. Eastern Time. Are there any questions that I can answer at this time? Okay, well, if there are any questions that come up, please feel free to email me. Oh, how many agencies are currently doing this Housing First? So we have about seven agencies that are currently administering this throughout the state. So there are a couple that are first-time program recipients and then a couple that are repeat. These are state funds, they are not federal funds. I cannot speak, in detail to the difference between this program and the ESG program because I do not work. No problem, Jennifer, because I do not work on the ESG program. But this is a state-funded program that was specifically created in 2017 to meet the needs of individuals with a co-occurring serious mental illness and a chronic chemical addiction. So there is no match requirement, and one of the benefits of this program is that we do have that flexibility to provide the rental assistance and the supportive services. IHCDA is really excited by this program to meet the need in the state, and we provide really, in-depth technical assistance throughout the grant term as requested by the recipient. Jennifer, I can't speak specifically, make comparisons between this and ESG, but hopefully that is helpful. So the total grant is $300,000 over the course of 2 years. So this is on a reimbursement basis. So we would reimburse that $300,000 over the course of 2 years. So it's not necessarily $150,000 each year. The trend that we see is that for new recipients, there is a little bit, it's a little slow for reimbursements in the beginning as the program starts up, and then, it's more robust towards the end. So we're not exactly looking for 150 each year. It's just 300,000 throughout the grant term, and that is the max. However, our minimum requirement is requesting 100,000. So you can request anywhere from 100,000 to 300,000, and then you can really customize, within our requirements, those services and rental assistance buckets, and then we can work with you if you need to submit a budget modification throughout the grant term to make sure that you're meeting the needs of your participants. I don't know if there's an average that the 7 agencies have received in the past. There are some years where everyone requests 300,000 and we're able to grant that. We have also seen that some first-time participants who have never had this grant before, who do have smaller capacity, request 100,000 to 200,000. And there is not a match requirement. But for a history of who has been awarded these funds in the past and how much they have received, you can visit our Indiana Housing First webpage, and you can see the board memos from the past couple of years, and you can see who received it and how many funds we had available and how much was granted to each agency compared to how much they requested. So that information is available on our website. Okay, are there any other questions either about the policies or the RFQ itself? Okay, well, feel free to reach out to me at any time prior to the RFQ deadline with questions. I'm happy to get on a call to answer any other questions or answer you via email. Our updated policy manual as well as the RFQ should all be available online. If you have trouble accessing those, please reach out and I will send you that information. Thank you so much for attending today. I look forward to potentially working with you all and have a great day. Thank you all so much. Bye.